Welcome to another policy video from the Ontario 360 project housed at the Munk School of Global Affairs and Public Policy. My name is Sean Speer. I'm a senior fellow at the Munk School and project co-director of Ontario 360. I'm pleased to be joined as always by my project co-director, Drew Fagan, who's also a professor at the Munk School of Global Affairs and Public Policy. And most importantly, we're joined today by our guest, Garima Talwar Kapoor, the Director of Policy and Research at the Maytree Foundation and Doctor of Public Health student at the University of Toronto. Garima has contributed a policy brief to our ongoing series in the lead up to the Ontario election campaign entitled Doing More for Those with Less, How to Strengthen Benefits and Programs for Low-Income Individuals and Families in Ontario. Garima, thank you so much for joining us today, and thank you for your contribution to the Ontario 360's pre-election series.
Not at all. Thanks so much for having me, Sean and Drew.
Why don't we start, Garima, by just setting the table with regard to the programs that are fundamental to support for this part of the population and how they've changed over time. This is something that's been an issue in Ontario politics and government for many decades. So bring us up to date, and then we can talk about your ideas for making the system better.
Absolutely. Thanks so much, Drew. So in Ontario, we largely have two social assistance programs. The first is Ontario Works, and the second is the Ontario Disability Support Program. Both were created and implemented in the mid to late 1990s. And, part of your question is, well, how have these programs changed over the course of the past couple of decades? And the short answer to that question is very little. And so I'd like to start off with just setting the stage on what these two programs are, who they support, what the intentions are, and what's actually happening today. So Ontario Works is a program of, quote, last resort in Ontario, and is typically a welfare program. It is provided to those that are deemed, quote, employable, and I'll get back to that phrase soon, and is really meant for those that, when it was first created, for those who are kind of in and out of the labor market, people who should have the capacity to attain labor market attachment. It's generally not for people with disabilities, though again, we now know that there's lots of people who receive Ontario Works who have impairments and illnesses that prevent them from working. But OW is really supposed to be your typical welfare program of last resort. The second program is the Ontario Disability Support Program, which is provided to those people who are considered to be disabled and have impairments that prevent them from being, quote, employable, or from having the type of labor market attachment that we think generally working age adults should be able to have. Again, these programs were created in the 1990s, in the mid to late 1990s, in a context economically, socially, and in terms of the labor market that just looks dramatically different today. And so what we've had is an Ontario Works program that now provides a maximum rate of about $733 a month for a single adult receiving OW, or about $1,169 for a single adult receiving ODSP. But at the same time, we know that the labor market has changed so much that a sense of precarity or a sense of a fissured labor market is now is a permanent fixture of our labor market. We know that housing costs and the cost of rent specifically has skyrocketed during this time. We know that the ability of people to gain a foothold into the labor market is made more difficult when you don't have the same type of compensation coming from work anymore, right? People at the lower end of the income distribution, people with low wages, tend to have challenges in control over scheduling, might have challenges in finding work if they're trying to find childcare, if taking public transit is a challenge and you're taking hours of time to get to work in the first place. So all of these issues compound together that Ontario Works and ODSP are no longer reflective of reality today. And so we've got almost 1 million people in the province who receive support through OW and ODSP. But I think regardless of where you are on the political spectrum, we can agree that that system of supports is broken.
So a couple more points as we sort of, as I say, set the table, and that was great, and you mentioned 1 million people. Has that been rising? Because when the reforms took place in the mid-90s, one of the arguments was that dependency on these kinds of programs was rising. And secondly, the rates versus inflation over the last decade, or in fact, two of those roughly 1 million people, as you say, on social assistance.
Yeah, great question. So over the past couple of years, what we've seen is Ontario Works caseloads have remained relatively stagnant and actually declining. But what's increasing at a much faster rate is ODSP cases. And so, overall, we did see that decline in cases and beneficiaries right at the outset when OW and ODSP were created. But since then, caseloads have moved up. And, a large part of the way that we design Ontario Works and ODSP around really strict eligibility criteria, really strict income tests, really strict determinations around, other types of income support or income replacement programs one may benefit from versus OW or ODSP means that, it doesn't actually demonstrate the level of need that is out there. We know through recent StatsCan survey data or StatsCan census data that about 1.5 million people live below the market basket measure in Ontario. So there, and there's a lot of reasons why people who are actually living in poverty don't qualify for OW or ODSP. And there's also, importantly, something that we have to get around culturally. There's a huge stigma associated with OW and ODSP support. And so some people who may qualify might actually not seek support because of the stigma associated with receipt.
You mentioned the issue of the generosity of the program and the fact that rates have been frozen for a long period of time, notwithstanding rising living costs, not just in our major cities, but really across the province. And the paper makes recommendations on how to address those issues. A separate yet related issue is the performance of these programs against their own objective or mandate, which is to help people transition from government support into the workforce. Do you want to talk a bit, Garima, about the failure of OW in particular in helping people transition off of social assistance, and in particular the issue of the kind of lack of durability for those who do at different times may transition out, but then find themselves back on social assistance in the medium and long term?
Yeah, absolutely. And I think that this goes back to, again, underlying principles and philosophies of Ontario Works and whether that makes sense today. So, we've closely monitored, how many people actually transition off of Ontario Works receipt and how many people come back and end up receiving support. And so it feels like, they are, that Ontario Works isn't meeting its objectives because we've got people who are not moving off of support. And again, I think if we think about the two arms or two levers here, we're talking about the nature of work and we're talking about income support. And for a long time, we've kept income supports really low with this idea that people would be incentivized to get into work. But the nature of work today is marked or is really defined, especially low-wage work, as unstable, unsecure work, where people are maybe working on fixed contracts, they're misclassified workers, They don't, again, have control over scheduling. And so the ability to generate a stable income and a secure income through work today does not look the same as it did in the 1990s. And I guess, some people would even argue that wasn't even possible then, but that notwithstanding. So I think what you've got today is a churn in the labor market, and you're seeing that same churn in the labor market being reflected in Ontario Works. And, there's a lot of movement in the service design of Ontario Works to change how services are delivered so that people receiving Ontario Works can transition into the labor market and stay off. And despite the Ontario government's move towards doing some of this work, we see through other jurisdictions that have undergone similar change exercises, like in Australia, where the same issues persist. And a lot of it, again, has to do with the nature of the labor market and the consequent issues, right? Your ability to afford a roof over your head. It may either instigate or exacerbate mental health illnesses or other physical illnesses one might have. It might prevent people from being able to, get the training and education that they actually need in this new labor market. So there's, in my view, a confluence of factors that are coming together, which then, to me, necessitate asking the question, does the underlying philosophy of Ontario Works need to be expanded so that it's not only about, incentivizing people to work or getting people back into the labor market, because work does not provide in the same way that it once did. And that is a big question that I think we all have to grapple with. What is the role of work today? But the second question being, is Ontario Works and social assistance, more importantly, a vehicle with which we measure our poverty reduction efforts by the ways in which we measure how the people in greatest need of support in our province are able to live a life with dignity. And I think that philosophical change, if we are able to grapple with that culturally as a province, might create the doors that we need to change how we conceptualize services, conceptualize supports, and then deliver them.
Drew, I'll turn it back to you in just one second, but it seems to me, in parallel with that philosophical debate that you're talking about, I think another key takeaway, the point you just made, is that we can't think about social assistance reform in isolation. It needs to be understood as part of a kind of broader policy rethink about labor market regulation, training, and so on. Or, as you say, the old way in which we measured success in social assistance is going to be misaligned with the current labor market and the economic context. So I think that's a terribly important point that ought to find support and salience across the ideological and political spectrum.
So part of the challenge is bridging those divides, if you would, which were chasms at what point, and you're now saying, and I think it's backed up by the evidence, certainly, are not chasms anymore, they're continuums to some extent. Mm-hmm. And then so you have a number of recommendations in that context to reform, improve, modernize the system. It does start with higher rates, I know, but there are, other steps that you suggest. So maybe you could take us through a few of those.
Yeah, absolutely. So in addition to higher rates, and that again is about a basic sense of dignity and adequacy in the system, but some of the more I'd say what would be dramatic changes and really help people. One thing that we could do immediately, there's very few low-hanging fruits available on this tree, and there's one that's left. And the one that's left is to integrate the structure so that basic needs and the shelter allowance are combined. Right now, under Ontario Works and ODSP, your shelter allowance is different than your basic needs allowance. And so your shelter allowance in Ontario Works is upwards of I think $397, if I'm not mistaken. And so, you can get only a maximum of that much in support for rent. And we know that a majority of people who receive social assistance live in private market rental housing, just like a majority of Ontarians who rent, and are just as exposed to the volatility in rent costs that we've seen. And so if we can bring everybody to the maximum shelter allowance, plus integrate it with the basic needs allowance, what you're doing is raising the rates that are provided to those who live in deepest poverty. Talking about people who are unhoused, homeless individuals. We're talking about people who live in rooming houses, who, in Toronto, this is a big area of debate around how we regulate rooming houses and multi-tenant homes in this city. But in the absence of proper regulation, and this goes back to an earlier conversation about regulation and support, there's, that is the one low-hanging fruit that's left, is the integration of shelter allowance and basic needs. The second piece that I would say is, when we think about raising the rates, we often think about them in terms of one government's ability to achieve that level of adequacy, without thinking about the roles that all levels of government have in providing support. So government structures and governments work in silos, but people don't work in silos, right? And that's a really, really key thing for us to think about. So if people like the proponents from Defend Disability are calling for a $2,000 rate for people receiving ODSP, and for the Ontario government alone, that level of adequacy may not be possible given our fiscal circumstances. But is that possible if we think about the federal government's role, especially with its newly proposed Canada Disability Benefit? Is there a way for us to stack up benefits, just like we do with the Child Canada Benefit, that helps, that helps families in need stack up the supports that they need? Another area of interest for us especially is thinking about how single adults receiving Ontario Works, or single adults who live in poverty, face the highest rates of poverty in Ontario and across Canada. And another way of bringing up supports for them so that they're not at the really meager levels of income support that is provided to them is to increase support that is provided from the federal government through other, through tax credit type supports, again, akin to the CCB or now the new Canada Disability Benefit. Another option, which is an option close to my heart, and something that I think really necessitates rethinking how we think about fiscal federalism in this country, is how the federal government supports provinces through the Canada Social Transfer. So we know that there's been huge calls from premiers across the country, not just over the course of the pandemic, but for years, to increase the Canada Health Transfer to help support our healthcare systems, which has been absolutely critical to do and the right thing to do. But advancements or enhancements in the CHT without enhancements in the social determinants that shape who gets unwell or who falls sick and faces health inequities or the burden of poor health outcomes helps us ensure that those investments in the CHT actually hold their value. And so I would argue that the federal government has a huge role to play in rethinking how it delivers support through the CST. The provinces should also be should also be coming forward and asking for an enhancement in the CST design, because otherwise, populations that are unwell, that are most likely to face poor health outcomes and in need of healthcare services are doing so. And we're kind of, it's like a leaky faucet. We're not dealing with the issue at its root.
I think you've just profiled some of your doctoral work there. Very interesting. And I think, if there's one major idea in today's conversation, it's something that Drew raised, which is this idea of a continuum, and that breaking through those silos that you mentioned earlier, Garima. Let's just wrap up with having you paint a bit of a picture on what you think a more optimal system may look like. It seems to me in the forthcoming election campaign, based on a combination of ideological or policy preferences across the different parties, the question of fiscal scarcity, which you raised, there'll be parts of your analysis that the different parties see themselves in more than others. But if you were king or queen for a day, what would the system look like? Am you give our viewers a bit of a picture?
Yeah, that's a great question. I am not a proponent of the basic income, so I don't want to push that forward, but I think some of the principles around simplicity, around adequacy are really salient, right? And so there's a way of using those principles and in shaping, in modernizing and transforming social assistance. So another, perhaps not low-hanging fruit, but still graspable, is this idea that people who are eligible for the Canada Pension Plan or disability benefit, EI or WSIB, if you are eligible for those benefits and are also receiving OW or ODSP, you cannot receive support from both programs at the same time. Your income from social assistance is clawed back by every dollar you receive CPP, EI, or WSIB income. And so that's a complexity that doesn't need to exist, right? Like, why, if I was eligible for a certain program because I've worked and have paid premiums and contributions towards this program, and I'm also in deep need enough that I qualify for social assistance, these recipients should be able to stack their benefits up without much cost to, with cost to the province in a way that that I think creates beneficial outcomes for people. I would revisit how we think about income testing in social assistance, right? This question earlier in our chat before was about what is the role of the welfare wall and meters in all of this. And I think that the role of meters is less salient in an income tax based support. So when you're thinking about benefits like the Canada Child Benefit, meters might not matter that much, or generally don't matter that much, because people's work efforts today might have an impact on future benefits a year from now when they file their taxes. But in social assistance, your incomes are recalculated on a monthly basis, basically, right? And so I would expand, in addition to enhancing the rates, which need to be dramatically increased, and that needs to be step one, I would also expand the income test and the earnings exemptions that are provided in both OW and especially in ODSP, so that people can keep more of what they earn and aren't, facing this dance that so many often do between work and not. And then on a really important side, outside of income, is the services question. And I think there's a lot of inequity between supports between the two programs. So some people can receive dental care, some can't. Some are eligible for another type, for benefits through assistive devices, while others might not be. And I think that there's a real necessity to think about how we harmonize benefits so that they're available to all social assistance recipients, regardless of the program that you are in. And eventually, and this is, I think, the key issue of debate in the election right now, expand them so that they are made more widely available to people that are low wage, whether they are working or not. And I think, those are some of the things that I would propose as ideas that have come before me. These aren't my ideas. I'm just amplifying things or ideas that have been advocated for before by people with lived experience, people who receive social assistance, and people who are trying to, in the policy world, trying to make the system better than it is.
Well, those are just important insights, and we're grateful for you to share them with us and our audience. Again, the paper is Doing More for Those with Less: How to Strengthen Benefits and Programs for Low-Income Individuals and Families in Ontario. Viewers can find it at our website, on360.ca. Garima, thank you so much for contributing to our series and for joining Drew and me today.